If you open a cancer center in Kisumu, it is for the entire region. Don't close your doors. Have an open door policy. If you open it in Kakamega, let it for the entire region and for the country. And I know we will follow your footsteps and make sure you open one in Siaya. Because I can tell you, if you hear what people go through, a death that should not have occurred, because you have got to move somebody from Siaya to Kakamega or to Eldoret or to Kisumu, I think we need health facilities as near as possible to our people. And in that regard, I want to announce that we got a surgical center and ICU which is under construction. It is also going to be able to be a place for training. But the most important flagship project that we have, and it's not about brick and mortar. Having a properly planned health facility is part of, making advances in the health sector. And under our manifesto and the CIDP, which is ongoing, the negotiations, we want an entirely new medical unit here in Siaya, because part of the facilities you see here are very dated. We have some buildings here which have got asbestos roofs, which are not proper. One of the things that we have in the health sector is about our planning, our vision, and what comes from the national government as policy. I always say that a salary given to a doctor or a nurse cannot be part of the wage bill. Because all the time CRA will tell you, you can't employ doctors because you're expanding your wage bill. Money paid to doctors and nurses is not part of the wage bill. It's part of our duty to make sure that we have doctors, we have nurses, so that we can succeed in our health campaign. And I want to say that in the recruitment exercise that is going on, one of the biggest bunch of people who want to recruit, and this is ongoing, is in the health sector, which will include doctors. And I hope Konyango and Dr. Omondi, I hope you are recruiting an oncologist, one or two, because that has been an issue in all our discussions today. I want to conclude by saying that Kenya is one country. Kenya is one country. Between Kakamega and Siaya, if you're driving from here to Kakamega and you ask somebody at the border where the border is supposed to be, they will not tell you. They will not tell you. There are people here who call themselves Nyaugenya, but you ask her to take you to their village, they'll take you to Kakamega. In Kakamega also I've heard people saying, maybe I'm from Wanga, but you find their home is in Siaya. So we should have a country where our boundaries are just artificial decorations. Those boundaries are not walls, but bridges to make sure that we build a strong, vibrant country called Kenya.
It is a spirited campaign that we have put as the first spouses from this region, and there's a reason for that. We are told that our figures are not very good, which means the numbers are highest in the Lake region. There is cervical cancer in the whole country, but the numbers are highest in the Lake region. And we have to do something. And as first spouses, as you know, are we elected? Yes. No. Are first spouses elected? No. Are they employed? No. They do service to humanity. So at this time, we have chosen as first spouses to get cervical cancer out of the Lake region, together with our partners. How do we do it? We started the campaign from Migori, and now we are here, and the day after tomorrow we will be in Kakamega, and we will be left with 4 more to finish. And we are having the same message. Go for early screening. Go for screening. Everybody, every woman, every daughter that you have who is 10 to 14, let them go for the HPV vaccination. Let your mothers, let your sisters, your wives go for screening. If caught early, then they can get treatment. I want to thank the warriors who came here. Thank you for your stories. And for sure, cancer is not a death sentence if caught early. And if not caught early, still it's not a death sentence. Something can be done. You can get treatment, although it is expensive. So today again, we are making an appeal. NHIF, cancer is not anybody's wish on their body. Governor, kindly petition the NHIF to treat cancer like any other disease until the patient is able either to overcome, or if they don't overcome, then they would have done their best. But at least let the burden not go to the patient.
And to be with the first ladies. After the children welcome you, I'll invite you to come and make your remarks.